First, the cervix, normal something lower portion of the uterus. So, cervix is the lower portion of the uterus where the uterus will join the vagina. That is the cervix. This cervical carcinoma or cervical cancer is caused by a virus, human papilloma virus. Cervical cancer is caused by human papilloma virus. So something about the normal anatomy. So this thing is a uterus. This entire thing is a uterus. The fallopian tube, the ovaries. And here you can see this one is the cervix. This entrance of the uterus, the lower portion of the uterus is the cervix. So in the cervix, there is a ectocervix. Ecto means outside. So this portion is the ectocervix and the inner portion is the endocervix. So the ectocervix and the endocervix. So this portion where the ectocervix and the endocervix will meet is called the transition zone. So the transition zone is the area where the human papilloma virus will colonize and it will cause cancer. So when the cervix is viewed from below, if you are watching the cervix from the vagina, when the cervix is viewed from below, we will see something like this. So the outer portion is the ectocervix. Outer portion is the ectocervix, which is lined by stratified squamous epithelium. The central portion is the endocervix, which is lined by columnar epithelium. So in between, there is a transition from squamous epithelium to the columnar epithelium. This is a transition zone or the transformation zone where we will get the cancer of the cervix. This portion is the place where we will get the cancer of the cervix. So the causative agent is a human papilloma virus. So initially, or when there are infections, they are temporary. They last for a few months and they will subside. So the first initial infections of this virus it is an inflammatory response. There is a small infection is there for a short period of time and it will go off. But repeated infections, when there are repeated infections, then the problem arises. Then it can lead to a pre-cancerous stage. If there are repeated and persistent infections of the cervix, then it can lead to a pre-cancerous stage that is called cervical intraepithelial neoplasia, CIN. It is a pre-cancerous condition. Just before the cancer, there is a stage called CIN, cervical intraepithelial neoplasia. So CIN, over a period of 10 years, it can develop into an invasive cancer or carcinoma. Carcinoma or cancer are the same. So this is a virus which is causing the cervical cancer, human papilloma virus. More than 100 strains are there. More than 100 serotypes of this human papilloma virus are there, but only 2 are most important, which can cause cervical. More than 70% of the cancers are caused by serotype 18 and 16, sweet 16 and 18. They will cause the cancer. Serotype 16 and 18, human papilloma virus, they are responsible for the cervical cancer. Repeated infections by these highly oncogenic viruses, serotype 16 and 18, they will cause the cervical cancer. So what happens? This HPV will enter into the cervical epithelial cells and it will produce 2 proteins, E6 and E7. These are the oncoproteins. These are the cancer-causing proteins. These proteins will inhibit 2 tumor suppressor genes. They will inhibit the tumor suppressor genes P53 and RB. These both are the tumor suppressor genes. So when there is inactivation of the tumor suppressor genes normally break to the cell cycle. But when these breaks are lost, because these P53 and RB tumor suppressor genes are inactivated, the cells will proliferate relentlessly. And when they start dividing relentlessly, there is accumulation of more mutations, which can lead to cervical carcinoma. This is the basis of cervical cancer. So the cause of cervical cancer is human papillomavirus. Human papillomavirus will somehow cause a loss of the break in the cell cycle. So the cells will divide relentlessly, where some more mutations are added, leading to cervical carcinoma. So HPV, this is HPV 16 and 18. They are responsible for the most of the cervical cancers. 100% are caused by the HPV, but among the HPV, the serotypes are the 16 and 18. 70% are caused by HPV 16 and 18. So they will act on the E6 and E7 proteins, and they will cause failure of the breaks of the cell cycle. So the cells will divide relentlessly, leading to cancer. So along with this, there are some more risk factors. The causative organism is a human papillomavirus, but this human papillomavirus exposure will occur when there is a early age of first intercourse, when the intercourse occurs in the very young age, or multiple sexual partners, or the male partner is having more multiple sexual partners, or these are all the risk factors which will cause exposure to the HPV, human papillomavirus, early exposure to sex, multiple sexual partners, the male partner having multiple sexual partners. These will cause exposure to the high risk strains of HPV, and they will land in cervical carcinoma. So along with this, when there is a decreased immunity, immunity also plays a role in the when there is exposure to HPV. Usually, the immune response will try to destroy the tumor cells. But when there is immunity is very low, the tumor cells are not killed by the innate immune system, leading to malignancy. Or when there is some other sexually transmitted diseases along with the HPV, that will also provide some more edge to develop the cancer. If the person is smoking, that will also decrease the immune response, causing increased risk of developing the cervical carcinoma or cervical cancer. So the risk factors are early exposure to intercourse, multiple sexual partners, the male having a multiple sexual partners, low immune response, low immunity, immunodeficiency, HIV individuals, heavy smoking. All these are the risk factors for the cervical carcinoma cervix. So the risk factors for the same thing: unprotected sex at an early age, the coexistence of other sexually transmitted diseases, especially HIV, human immunodeficiency virus, which will lead to immunodeficiency, and smoking will also decrease the immunity, leading to increased risk for cervical carcinoma. So the pathogenesis. So following exposure to the HPV, because of the decreased immune response, or because the individual is genetically susceptible to develop carcinoma, they will develop a precancer stage called CIN, cervical intraepithelial neoplasia. So over a period of 10 years, this CIN can progress to cancer, cervical cancer. So the low risk variants, they will cause some other papillomas, some growths can also occur with the low risk strains. These are not harmful, not very harmful. This is not cancer. Condyloma is not cancer. So we'll see what is CIN and what is invasive carcinoma. So here on the right, on the extreme left, this is the normal cervical epithelium. There is an orderly arrangement is there. As the cells move towards the surface, there is flattening of the cells. But CIN1 means cervical intraepithelial neoplasia 1. There are abnormal cells. The cells with the increased nucleus are seen in the lower 1/3 of the thickness of the cervix. That is CIN1. If the abnormal cells are extending up to the 2/3 of the entire cervix, that is called CIN2. If the abnormal cells are seen, if the cancer cells are seen, extending to the upper 1/3 of the cervical epithelial lining, then it is called CIN3. So in situ carcinoma means the entire thickness is involved, and invasive carcinoma means the abnormal cells are going beyond the basement membrane into the stroma. That is invasive carcinoma. So CIN is cervical intraepithelial neoplasia. 1, 2, and 3. 1 means lower one third. The cells, abnormal cells are confined to the lower one third. If the abnormal cells are confined to the lower two third, then is CIN2. If the abnormal cells are extending to the surface, then CIN3. CIN3 is synonymous with CIN3 and carcinoma 1 C2 are almost the same. So invasive carcinoma means there is a breach in the basement membrane and the tumor cells are infiltrating or invading into the beyond the basement membrane. That is called invasive carcinoma. What are the clinical features of cervical carcinoma? Clinical features of cervical carcinoma. Some cases are asymptomatic, but in the starting stage, there is a vaginal discharge. It is called a white discharge. White discharge is a leukorrhea or white discharge, but it is a very foul-smelling white discharge is there initially. So maladress, and then there is a bleeding per vagina. There is a red discharge from the vagina. Following sex, there is a bleeding, and also there is a pain during sex. So these are the clinical features. When there is a watery discharge, and following that there is a reddish discharge from the vagina, and during sex there is a pain and bleeding. These are all the symptoms of carcinoma cervix. Sometimes they express discomfort in the vagina, low backache, back pain, and pain during urination. These are also the clinical features for carcinoma cervix. Leukorrhea, white discharge, red discharge, which is very foul smelling, and pain in the back pain, and pain during sex, and pain during urination. These are all the clinical features of cervical carcinoma cervix. And when the carcinoma spreads, it can cause urinary obstruction. It can cause blockage of the tubes which drain the urine. Then it can lead to urinary obstruction. Or it can also spread to the rectum, which is present behind the cervix, and it can cause constipation. Or there can be blood in the urine, hematuria, or there may be pain, or there may be swelling of the legs, and even sometimes the kidneys are also swollen. So these are the complications of the carcinoma of cervix, cancer cervix. These complications will occur in the advanced stage when the cancer spreads and blocks the pipes which drain the urine. Then there is urinary obstruction. Sometimes the cancer may block the bowel or the intestines. Then it can lead to constipation, hematuria, the blood in the urine. These are the complications of carcinoma cervix. So this is how the carcinoma cervix will appear. It will appear as a friable reddish ulcerated lesion on the cervix. So here you can see this is the normal cervix. This is pale pink in color and it is glistening and shining. This is a normal cervix. So this is a perspeculum appearance of the cervix. This is a normal cervix which is appearing shining and very smooth pale pink cervix is there. This is a normal. But here you can see a ragged ulcerated lesion, an ulceroproliferative lesion is there. This is the carcinoma of cervix, the cervical cancer. This is the gross appearance. This is the naked eye appearance of the carcinoma cervix. So how can we detect the cervical cancer? So the test which is very effective, the most effective test which is to date, the best test to diagnose the cervical carcinoma or any kind, for the sake, the best test to diagnose the early stages of carcinoma or cancer cervix is pap smear. Papanicolaou is a scientist. He is the one who visualized the cervix first. He has taken the spoon and retracted both the vaginal walls and observed the cervix. So what he did is, after retracting the vaginal walls, he had scraped the vaginal walls, the cervical walls with a wooden spatula and spread it on the smear and observed under the microscope. So when does the pap smear needed? So the recommendation for pap smear is done for the early diagnosis of cervical cancer. So before 21 years, it is not needed. So from 21 to 29 years, every 3 years pap smear is to be done. So after from 30 to 65 years, the pap smears can be done. Along with the pap smears for every 5 years, HPV, human papilloma virus antibodies can also be done for the early diagnosis of the cervical cancer. So the pap smear, the recommendation is from 21 to 29 years, every 3 years. After 29 years to 65 years, along with the pap smear, we can go for the HPV antibodies, human papilloma virus antibody testing for every 5 years. After 65 years, there is no need for going for screening because the peak incidence is around 45 years. That is the time where this cervical cancer connect. 45 years is the peak incidence. So pap smear is to be done from 21 to 65 years every 3 years screening. So the interpretation of the reports which we give, the pathologist will give a report of the pap smear. Most of the pap smears are NILM. NILM means negative for intraepithelial lesion or malignancy. So simply negative for malignancy is the NILM or inflammatory smear. Inflammatory smear means there is no malignancy. Some infection is there. That is inflammatory smear. But sometimes we give the report as ASCUS. ASCUS means atypical squamous cells of uncertain significance. That is ASCUS. So ASCUS means we are seeing some atypical cells are there, but very few are there. So we cannot say confidently whether this is going to lead to a malignancy, whether this is going to turn out to be a cancer or not. Then we give a diagnosis which is not straightforward. It is in via media. That is called ASCUS, atypical squamous cells of undetermined significance. So the next, just one step ahead is LSIL. LSIL means low grade squamous intraepithelial lesion. So this report also we will give. That indicates there is some precancerous change is there. That is LSIL. HSIL means one more step ahead towards carcinoma, towards cancer. HSIL means high grade squamous intraepithelial lesion. So this is a grading system. As we go down, the tendency to turn into a cancer will increase. ASCUS means not very risky, but mild risk is there. Very mild risk, ASCUS. It can cure by itself. LSIL means very very mild. Here also very mild risk is there. LSIL. So HSIL means high grade squamous intraepithelial lesion. This can turn to cervical carcinoma. So these are the reports which we give. So if HSIL report is given, that doesn't mean that person is having carcinoma, cancer. That means that the person may, out of 100 persons, 10 persons may develop carcinoma in the next 10 years. So that is HSIL. It is a pre-cancer stage. Both these are pre-cancer stages, LSIL and HSIL. So this is the report which we give in the pap smear. Pap smear we give as inflammatory smear or NILM. That is not malignant, not cancerous. So if you get a diagnosis as HSIL, that means it is a pre-cancerous lesion. It can turn to be cancer. So this is what we will see under the microscope. After the when the pap smears are stained, we will see the slides like this. This is normal. This one is normal. Here you can see some normal cells over there. These are the normal squamous cells. So this is LSIL. This is LSIL, low grade squamous intraepithelial. The nucleus is enlarged. This is HSIL. The nucleus is very much enlarged. High grade squamous intraepithelial lesion. This is carcinoma in situ. This is cancer. So this this is what we do, pathologist we do. So one thing for cancer diagnosis is pap smear. The another one is biopsy. Biopsy means they will take a part of the cervix and they will send to us. So in the biopsy, we will give as a CIN1, CIN2, and CIN3 or carcinoma. CIN means cervical intraepithelial neoplasia. CIN1 means the atypical cells are present in the lower 1/3 of the basement membrane. CIN2 means lower 2/3. CIN3 means the entire thickness is filled with atypical cells. So 1/3, 2/3, 3/3. Entire thickness is filled is CIN3. Next is the invasive carcinoma or cervical cancer. So how many of these LSIL will turn out to be or will advance? So when the LSIL report is given, so LSIL is a pap smear report. CIN 1, 2, 3. These are the biopsy reports. So LSIL will correspond with CIN 1. LSIL, they will regress. 60% will regress. 30% will stay as they are. And 10% will turn out to be HSIL over a period of 10 years. So this HSIL, 10% will progress to cancer. High-grade squamous intraepithelial lesion, 10% can progress to cancer. So HSIL is more risky. HSIL, this LSIL or HSIL, HSIL can revert back and it can subside, regress. But 60% will persist as they are and 10% can progress to cervical cancer over a period of 10 years. So this is CIN1, lower 1/3 showing the atypical cells. This is CIN2. This is CIN3. And this is invasive carcinoma. The cancer is passing beyond this is a basal membrane. This entire line is a basal membrane. When the tumor cells will pass beyond the basal membrane, then it's called invasive carcinoma. These are the histopathologic images. This is the normal cervical epithelial lining. And this is the cervical cancer, CIN3. The atypical cells are filling the entire thickness. This is CIN1. Only lower third is showing the atypical cells. This is CIN2 and this is CIN3. Cervical intraepithelial neoplasia. So this CIN1, CIN2 and 3, they correspond to HSIL. LSIL corresponds to CIN1. CIN1 corresponds to LSIL. CIN2 and 3 correspond to HSIL. They can progress to carcinoma in situ and invasive carcinoma. So the diagnosis of cervical carcinoma is by pap smear, colposcopy, or cervix biopsy. So the first thing we will do for any women is the pap smear. If the pap smear is abnormal, so what does the pap smear procedure will involve? So they will separate the vaginal walls with this speculum, and with the help of a spatula or a brush, they will collect the cells from the cervix, and these cells are shed on a slide, and the cells are observed under the microscope, and the pap smear report is given. So this is what the pap smear test involves. The vaginal walls are separated with the help of a speculum, and a spatula or a cervical brush is inserted, and with the help of a spatula, the cervical epithelial cells are scraped, and with the help of the brush also, the cervical cells are scraped, and on the glass slide, these cells are spread, then they are stained and examined under the microscope. That is what the pap smear procedure involves. If there is any abnormality like HSIL or LSIL, then we will go for the colposcopy and the cervix biopsy. So the pap smear test, it involves the scraping of the cells from the transformation zone and examined microscope. So this is the most successful cancer screening test ever developed, pap smear test. So this is colposcopy. Colposcopy, the gynecologist will visualize the cervix. So when the cervix, normally we have seen initially, it is a very pale pink structure. This entire thing, if it is pale pink, there is no problem. If there is some laceration, some abrasions are there, this is the low grade LSIL, low grade squamous intraepithelial lesion or cervical intraepithelial neoplasia. This one is a high grade. Here you can see an ulceroproliferative lesion. This is a cervical cancer. This quadrant shows the cervical cancer, which is an ulceroproliferative lesion. So this is a normal, and ulceroproliferative lesion is the cervical cancer. So during colposcopy, when the pap smear is abnormal, we will ask for colposcopy. So the gynecologist will apply 3% acetic acid on the cervix and wait for some time. If there are white streaks over, if there are white streaks, if there are white streaks over the cervix, then it indicates that these cells are abnormal. So this white part is biopsy. Biopsy means we'll remove a small piece of tissue and send to the histopathology lab, where the pathologist will process and he will have look into the tissue. So acetic acid is applied over the cervix, where we can see some whitish appearance. This is the CIN1, and this is CIN2, a bigger one. This is CIN3, much more confluent white areas are there. This is CIN3. So after colposcopy, biopsy is taken. The biopsy is sent to the histopathology. So the CIN cervical intraepithelial neoplasia, it precedes some decades. The peak is around 30 years. CIN peak is 30 years. Whereas carcinoma, from CIN to carcinoma, it takes around 10 years. From cervical intraepithelial neoplasia to invasive carcinoma, it takes around 10 years. So the peak for the invasive carcinoma is 45 years. CIN peak is 30 years. Invasive carcinoma peak is 45 years. So first an abnormal pap smear report. It is followed by the colposcopy with acetic acid, and the abnormal areas are sampled. They are biopsied with the biopsied, and it is sent to the histopathology lab. So for LSIL, we don't do any treatment. It will subside. We have seen that 90% will regress. Only 10% will progress to HSIL. We will just follow up. For LSIL, the treatment is masterly inactivity. We won't do anything. We will ask them to repeat the pap smear after 1 year or so. So when HSIL is there, high-grade squamous intraepithelial lesion, then cone biopsy, wherever the abnormality is there, that part is biopsied and sent to the histopathology. And then again follow-up is done for life. So follow-up, these people, HSIL people, are always at risk of developing other cancers, cervical cancer, vulvar cancer, vaginal cancer. These cancers can develop. So this is a biopsy. Biopsy means the part which is abnormal, that is taken with the help of scissors, and it is sent to the histopathology lab. So next is a grading of the staging of the cervical carcinoma. So there are 4 stages: stage 1, stage 2, stage 3, stage 4. Stage 1 means the carcinoma is confined to the cervix. Stage 1 means it is confined to cervix. It has not spread to other parts. When it is not visible grossly, that is 1A. If a lesion is visible to the naked eye, then it is 1B. So stage 2 means this is stage 2. Stage 2 means this part, lower part is the vagina. If the tumor has spread to the upper 2/3 of the vagina, or if the tumor has spread to the lateral walls, that is a parametrium, then it is called stage 2. Stage 2 means it has crossed beyond the cervix. That is stage 2. Stage 3. Stage 3 means the tumor has spread to the pelvic wall. Lateral pelvic wall is there. If the tumor has spread to the, this is the pelvic wall. That is stage 3. So stage 1 is within the cervix. Stage 2 means it has passed beyond the cervix, but not onto the pelvic wall. Stage 3 means it has passed beyond the, onto the pelvic wall. Stage 4 means distant metastasis is there. Stage 4 means the tumor has spread to other lungs, liver, everywhere. That is called stage 4. When the tumor has spread to other parts of the body, the rectum, the bladder is present in front, the rectum is present behind, in posterior to it, behind is the rectum, anterior is urinary bladder. So in case of cervical carcinoma, advanced carcinoma, there is obstruction to the urinary bladder leading to urinary obstruction, or there can be obstruction to the bowel leading to constipation. So the treatment, the CIN 3 and 4, this is an anti-cancer drug, 5-fluorouracil is given. For stage 0, the cryosurgery, liquid, this is compressed nitrogen gas, minus 40 degrees is maintained, and this gas is sprayed on the lesion, so the tumor cells will die. Compressed, that is cryotherapy, using cold to kill the tumor cells, cryotherapy. LEEP means loop excision, loop. This loop is used. This is a lesion. And this loop electrosurgical excision procedure, the loop will just scrape off the abnormal part. That is called LEEP. That is one modality of treatment. So for stage one, the cervix is removed. Tricholectomy means the cervix, amputation of cervix is tricholectomy, or hysterectomy. Removal of the uterus is called hysterectomy. Removal of the uterus is called hysterectomy. Removal of the cervix only is called tricholectomy. So stage two, for stage two, radical hysterectomy. The entire uterus with the fallopian tubes, the pelvic lymph nodes, that is called radical hysterectomy. Chemotherapy is also done in case of stage two. In stage four, it is only palliation. The prognosis is very bad. Stage four, chemotherapy and radiation is given. So how to prevent? Prevention of cervical carcinoma, primary prevention is by giving the vaccine, HPV, human papilloma virus vaccine is given. So this Cervarix, it is a bivalent. It acts against the 16 and 18. This Gardasil acts against the 4 variant. This is a quadrivalent. But these are less harmful. 6 and 11 are less harmful. So prevents the infection of the virus causing the cancer. So when this vaccine is given, the vaccine which we give, we will destroy the pathogenic properties of the virus, and the antigenic properties of the virus is retained. So after giving the virus which is attenuated, the body will develop antibodies towards the virus, which can be infected later. When this real virus enters, the antibodies will kill the virus and they will protect immunity. So HPV vaccination is effective against the human papilloma virus. It kills the virus. That is one method. Primary prevention is by giving the human papilloma virus. Secondary prevention is by doing the pap screening, pap smear. Pap smear is done from 21 to 65 years, every 3 years. It will help in early diagnosis, and thereby we can prevent the cancer-related morbidity. Other method is by doing the HPV antibodies along with the pap smear. Every 5 years, HPV antibodies can also be done for early diagnosis of HPV infection. So what does the HPV vaccine do? So the ideal age for HPV vaccination is even before the sex. 9 to 21 years. This is the best age. But it can be taken up to 45 years. After 45 years, no use. The HPV vaccine must be given between 9 to 21 years. The number of vaccines is 3 vaccines, 0, 1, and 6. So after the first vaccine, another vaccine is 3 doses are given. The period between the first and the second vaccine is 1 month. And the second and the last vaccine is 6 months. 0, 1, 6 is the these are the booster doses. 1 and 6 are the booster doses. So after 45 years of age, no use of giving the HPV vaccination. So this vaccine will stimulate the immune system to produce antibodies against the HPV types, thereby preventing the HPV infection and subsequent development of cancer. So that's the topic. Thank you all. Yes, if there is anything to discuss.
Sir, thank you. Sir, there are a few questions again I have. So if anybody has a question, they can go ahead, else I'll ask.
Yes, ma'am.
Guys, do we have a question?
So this kind of vaccines, like once middle age, more than 40 years, how effective it is, like HPV virus, a vaccine?
The vaccine, the ideal age is even before the exposure to sex, 9 to 12 years. That is the best age. After 45 years, then there is no use, because by the time already we got exposed to the human papilloma virus. So no use of vaccine after 45 years.
Okay. These days, all pediatricians also are recommending for, male children.
Male children, because, yes, ma'am, there is this human papilloma virus. This can cause not only cervical carcinoma, It can also cause cancers in
Prostate.
male also. It can also cause penile carcinoma, glands
Yeah,
penis.
yeah. Mm.
In other, the human papillomavirus can cause carcinomas of the penis, of the oral cavity, of the anus, wherever there is a mucocutaneous junction, wherever there is a squamous epithelial lining. This have human papillomavirus can cause cancer. So it can also be given to the male also, but the female are at more risk of developing the cervical carcinoma when compared to males.
So Lakshmi ma'am
Just
is asking I guess a similar question. HPV vaccine male ki kuda vecha. So I
yes,
don't
yes,
understand, but yes, I
yes,
guess
yes,
that answers.
yes. Male also, it is of advantage. It will prevent the development of the carcinoma by the HPV virus.
Yeah, that's
Male can also be given.
right. Do we have more questions? Okay, so I had three questions. One, say for example, we have this cervix cancer, right? So we had a discussion that using during biopsy, usually we had seen that breast cancer could spread, or there is a possibility. In this case, is it similar case, or this cannot spread beyond the uterine wall?
The carcinoma of cervix can spread or not? That's what your question, ma'am.
Yes, sir, yes, yes.
It will spread. It can spread.
It
Cancer
can
can
spread.
spread. No, it can spread.
Okay.
But
Spreading
distant
possibility.
metastasis is very less in case of carcinoma cervix. In case of cancer of the cervix, the most of the deaths are because of renal failure. The cancer of the cervix is very close to the ureters, or the tubes which connect the kidneys and the urinary bladder, where the urine is drained into the urinary bladder. So they will cause obstruction of the urinary bladder, and they will land up in renal failure. Even before the distant metastasis can occur, the death will occur in case of cervical carcinoma because of renal failure. So
Yes,
distant
sir.
metastasis is not very common, as in case of breast carcinoma. Metastasis will occur. The tumor will spread to other parts of the body, but even before the tumor spreads to the other parts of the body, death will occur because the urinary obstruction will cause renal failure, thereby leading to death.
Get that. Sir, that was the second question, that probably it can spread to the urinary parts also, right? Okay, so the next question was one of my clients, she had a cervical TB,
Cervical TB,
tuberculosis.
tuberculosis, good, yes.
So, is there like how would we, obviously, very lame question, how would we identify whether this is just that inflammation or TB or the cancer cell proliferation?
Okay, the best thing is to go for a biopsy. The doctor will ask for the biopsy, means a piece of tissue where there is a lesion is removed and sent to the pathologist. This tissue is processed and it is observed under the microscope. So if you are seeing some picture, granulomas are there, some necrosis is there, we will diagnose that as tuberculosis. If you are seeing some epithelial, some features are there, we will diagnose the tuberculosis. If there are some type of malignant cells are there, we will say it is carcinoma, cancer. So your question
Right.
is whether the tuberculosis, how to identify whether this disease is tuberculosis or cancer. That's it, man.
Yes,
So
sir.
the
Yes, sir.
biopsy will prove. Biopsy will help in diagnosis.
Right. So now coming to the nutrition part of it. So for this client of mine, she was having tuberculosis. So it was that her immunity was low. I was working on the vitamin A, C, and D, E, as you mentioned last time. So I was giving her that. In this case, what are the most probable things that we can help with during the initial stages?
Frankly speaking, I don't know the answer. That is not my area, so I don't know exactly. But nutrition will help. I cannot comment on this.
Okay, sir. So again, similar question. Usually in Ayurveda, there is this exercise, pelvic workouts given to the
Yes.
females to avoid these kinds. So is that the workout really recommended for people having uterine problems or not?
Workout. It is required.
It is
It is.
required because
They
we
will
had been
prevent
asked.
they will prevent from the prolapse of the uterus in old age. So it is required. You are
Because we
seeing
usually
that
ask them to
butterfly
do.
stretch and all those things.
So butterfly stretch, duck walk, and things like that.
That is
So,
good, madam. The pelvic muscles will be more tensed, and they will prevent the prolapse of the during old age at 60s or 70s. There's every chance of prolapse of the uterus coming from the vagina into the exterior. So these chances are decreased by doing the pelvic exercise. They are recommended.
right.
Yes.
And
Sir, initially, like after puberty, most of the girls, like these days, not these days, like most of the youngsters, they use lot of contraceptives, right? So
Okay.
that is also one of the biggest cause of this cervical. So,
Yeah. I got it. So actually, some PowerPoint presentations are saying that this OCP will increase the risk of cervical carcinoma, but the Robbins pathology, which is the Bible of medicine, it doesn't comment anything about the OCPs. So I didn't include that part. So to the medical from the allopathy side, the OCPs are no risk for cervical carcinoma, cervical cancer.
okay, thank you, sir.
Yes.
so same goes with nowadays. There are this easy to pop in pills, eye pill, and all that stuff. So, does that have any relation to the breast cancer or the cervix cancer?
Cervical cancer, there is no risk, ma'am.
Okay.
Breast cancer, no. Last class I have taken. I didn't remember.
No worries, sir, no worries. I'll work it out. Because there are, I had seen people having fallopian tube rupture with eye pill, atopic pregnancy. But
Ectopic pregnancy will lead to rupture of the fallopian tube. Yes. So
nothing to do with the cancer thing here. If they're
no.
popping in pills.
I have to refer.
Okay, sir. I'll get back to you on this.
Yeah.
Right.
So
Guys, do
regarding
we
the recording, it's there in the laptop. You just help me out. I will send it.
Sure, sir, sure.
This one you are having, no, ma'am?
Yes, sir, I have recorded it.
Yeah. Good. Yeah.
Guys, do we have more questions? Yes, or ma'am, please.
Sir, I have a question regarding the vaccine only, sir. Since
Yeah.
the vaccine contains this attenuated viruses, right?
Yes.
Means it doesn't have the ability to cause any disease as such.
Yeah. Pathogenicity is reduced and the
Yes.
antigenicity is retained. So the ability to form
Okay.
antibodies is retained, the pathogenicity is crushed out. So there
I mean,
new
means-
antibodies can be formed, and these antibodies will kill the virus which is invading the and causing infection. So when the infection is cleared, there is no chance of cancer.
I mean, sometimes, sir, the virus as such doesn't cause any infection. Sometimes it releases some sort of proteins. I mean,
Yes. E6
obviously
and
those are
E7 proteins.
antigens, right?
Uh,
So when the virus itself is not active, that means the body will not detect, right? I mean, there is an infection and then infection response will not be there. So how does that, I mean, what is the efficacy of taking the vaccine? Can it prevent 100% or like how?
There are more than 100 serotypes are there, but only 30 serotypes are causing the
Cancer.
This cancer. And among them, 70% are caused by 16 and 18. Vaccine is given only to the 16 and 18. So there is a minor risk. Always there is a minor risk.
Okay. Sir. Thank you, sir.
Yes, ma'am. So next topic would be interpretation of the lab reports. So I will try to take another class. Regarding cancer, I hope these two classes are sufficient. So next, I would like to take about the interpretation of the lab reports. So some people are saying that we are having difficulty with the interpretation of the lab reports. So I will try to take one by one. I will try to interpret the hematology test, the liver function, like that. I will try to sort out the things and take the classes.
Sure,
with
sir. Sounds perfect.
From our Suresh, our founder.
Sir, I am not very sure about it, but I am 99% sure that he would be more than happy to have that.
Yeah. I will inform him and we'll go ahead.
Sure, sir. So guys,
So
I'm planning to have these classes on every Thursday, 7 to
yes, ma'am.
8. So I
Thursday
guess
is
that will
best.
be so. Yes, yes,
Thursday is best.
right.
Thank
Yeah,
you.
Neelam ma'am, just one thing before we close. Like,
Yes,
so, what I understood is key, having a preventive relationship. It is like big things we can I mean, take care of to avoid this cancer.
prevention is better
Madam,
than
you are
cure. Yes,
saying
Hina
that
ma'am.
if we use condoms, it is more protective? Definitely.
Yeah,
Condoms are
so
protective
because
against cervical cancer.
because if it is spreading through the
Yes, condoms are
virus, so
protective
it is the
against
only
HPV.
way, right?
Thereby, it will cause protection against cancer. You're right.
Okay, thank you, sir.
Yeah.
Hina, thank you for raising that point. Sir, there are females who have a complaint of drying vagina.
Yeah. It is due to
Right.
deficiency of estrogens.
It is due to
Hormone.
depression.
Yes.
So when it is a drying vagina, we would not have this kind
That
of a
is
problem.
drying vagina.
Sir, dryness in the vaginal area have been complained by some of the females.
Hmm.
So it has nothing to do with this. It is something else that we are dealing with.
Oh, you're saying if the dryness is there, does it indicate it is a precancer stage?
Yes, sir.
That's
Yes,
it,
sir.
madam? No,
Yes,
it
sir.
is not precancers.
Right.
So we can say whether precancerous or not, we have to go for pap smear. That's the thing. Every 3 years, pap smear has to be done routinely. But it is not a sign of cancer.
Get
Dryness
that.
is not a sign of cancer.
Get that, sir. Get that.
Yes. Can I take a leave?
Yes, sir.
No.
Thank you. Thank you so much for your time, sir.
Thank
Really
you.
appreciate it.
Sir, I have a question
Thank you.
about that prolapse uterus.
Yes, madam.
Sir, you said a prolapse uterus, how it start the starting point and how it convert in a cancerous, sir.
Prolapse does not convert into cancer.
Okay.
She asked whether the Kegel exercise will be helpful with, does it have any benefit or not? Definitely the Kegel's exercise will prevent prolapse of the uterus. Maybe if the prolapse occurs very frequently, because of prolapse, the cervix can get irritated and very later it may turn into a precancer stage. But by the time prolapse occurs, it is 60 years. But carcinoma cervix, the peak age is 45 years. So very minor risk is there with prolapse and cervical carcinoma. Very, very, very minor.
Okay, sir. Thank you.
Yeah. Thank you all. Madam, I got one thing. So how to share this, the previous classes? I don't know.
So I will call you just right now. So we'll
Yes.
discuss.
Yeah. Thank you all. Bye.
Thank you.